So today I am here with the amazing MP Don Davies. He is our health spokesperson and has taken a very powerful leadership role in working and supporting the government to move towards having more dental care. And he'll talk a little bit about more of what he's doing in that area. I also want to thank Brandon Doucet, who is here with us today. He is from the Coalition of Dentalcare and will be talking to us a little bit about the work that they're doing. And Joan Rush is here as well today, and she is going to talk to us about dental care for people living with disabilities. We will have a period of time for questions. If you want to ask a question, please message either Christy or Lucas. You'll see their names here, and they have MP Rachel Blaney's staff on there. So just if you could message them and let them know that you're interested in asking a question, we would appreciate it. We just want to make sure it's as organized as it possibly can. And of course, if you don't get a chance to have a question that you have answered, or you have something you want to share that's a little bit more personal, please just reach out to our office by phone or email and we'll get back to you and do what we can to assist you as soon as possible. So again, thank you so much for participating. And Mr. Don Davies, I'll pass it on to you. Make sure Don can unmute.
Thank you. Yeah, I was prevented from speaking, which many wish would be more of a permanent thing. It's a genuine pleasure to be with all of you tonight. I'm Don Davies, MP for Vancouver Kingsway, and I'm privileged to be the federal New Democrat critic for health. I am calling in from the traditional unceded territory of the Coast Salish people, the Squamish, Tsleil-Waututh, and Musqueam First Nations, by whose grace and permission we gather and work every day. I want to start just by thanking Rachel. Speaking of leadership, I know that we have sensational members of parliament in all corners of this country, but I think we're particularly blessed on Vancouver Island. And I just have to think that the people of Vancouver Island must just be of sensational caliber and acuity to choose such wonderful people to represent them in Parliament. And you're very blessed to have Rachel Blaney. I get to work with her and see her up close. And not only is she an outstanding member of Parliament who is extremely hardworking and respected across party lines, but she also is the NDP whip. And it's the kind of job that many people in the public don't see what it entails, but it's a very, very responsible position that has a lot of duties to it that makes our party function at the federal level. And I just want to say what an honor and privilege it is to work under Rachel's leadership and thank her for that. I think the way that this evening is going to go is I'm going to speak for about 5 minutes, then turn it over to Dr. Doucet and then to Joan Rush. And then I will speak a little bit in detail about the NDP plan for dental care. So I'm just going to give some opening remarks just to center the discussion, if I might, and then I will come back and focus for my part directly on what the NDP is proposing as a solution to this. So in terms of just generally centering us, I think that it's very well known that Canadians are extremely proud of our public healthcare system. In fact, polls have shown that it's something that we believe sets us apart as a nation and binds us together, particularly when it comes to distinguishing us from our cousins to the south of us. And I think we're justifiably proud that we make sure that every person has access to physician and hospital care, regardless of where they live, and more importantly, without regard to their ability to pay. But the truth of the matter is that our healthcare system is not comprehensive. And we know that our healthcare system does not offer universal public access to many things like pharmaceuticals, mental health services, auditory care, eye care, and importantly, dental care. Now, all of these things are vitally important, but I think of all of the serious gaps in our healthcare system, one that is perhaps most acute and stands maybe a little bit above the others is the lack of access to oral health care. The Canadian Dental Association itself estimates that 32% of Canadians, so call it 1 in 3, does not have dental insurance in this country. That means that about 1 in 4 Canadians does not visit the dentist every year simply because they can't afford it. Now, of that 32% of Canadians, that doesn't mean that the rest of Canadians are well served, because even those that do have some form of dental insurance doesn't mean that they have adequate coverage. Many dental plans are far from perfect. They have co-payments, they have annual limits, and a variety of other limitations. That means that even those people that have dental insurance don't get access to all of the care they need when they need it. But what's very interesting about it is it's not just a quantitative issue, it's a qualitative one. When you think of who those 12 to 13 million Canadians are that are walking around this country right now with no dental insurance, it's among the most marginalized Canadians. It's obviously low-income Canadians, it's single-parent families, it's women, it's children, it's seniors, it's young workers who often work in the gig economy and don't have any access to extended health care benefits. It's new Canadians. So in addition to the health impacts of this, there are also extremely profound social impacts. There's shame, there's mental health issues, there's social exclusion, there's even loss of job opportunities. If you think of the assumptions we make when someone showed up at a job interview and they were missing their front tooth, what the assumptions are we'd make of them. And the thing, of course, is as we wear our visage, we wear our teeth on our face, it plays a very important role in our self-image and again, in the quality of our mental health. So there's a very significant class issue, a very significant intersectional issue, a very significant economic issue, and most importantly, an extremely serious health issue. Poor oral health is not just a matter of cosmetics. It is linked to a number of serious problems, including cardiac problems, diabetes complications, even low birth weight and premature birth in women. I have read the statistic, and Dr. Doucet can correct me on this. In fact, I may have heard it from him that about 1 million Canadians have chewing problems. And if you think about that and how important nutrition is to our overall health, when you're interfering with the ability of people to eat properly, you have a whole host of issues that come from that. The bottom line is there is an absurdity in our healthcare system, and that is oral health, which is as important to our overall health as any other part of our body, is curiously excluded from our public healthcare system. Now, this is very strange because that wasn't the way it was supposed to be. In the 1960s, when Tommy Douglas was leader of the NDP and was pushing a minority liberal government to bring in healthcare, based on the Hall report, which was a report from a former Supreme Court justice named Emmett Hall, who had been appointed by John Diefenbaker and was expected to recommend against public healthcare, but shocked everyone by recommending for public healthcare based on the Saskatchewan model. He, in that report, recommended that our public healthcare system be comprehensive and include dental care, as well as pharmaceutical coverage, by the way. And the only reason, curiously, that dental care was not part of our public healthcare system starting in the 60s was simply because at that time it was considered that we didn't have enough dentists in the country to be able to provide universal services to every Canadian. By the way, that ceased to be the case many decades ago. So the bottom line is we have a very, very serious omission in our public healthcare system. It's affecting millions of Canadians, and we think it's time to close that gap. So I think that's enough to situate the problem. I'm now very pleased and honored to introduce our first speaker, who is Dr. Brandon Doucet, who is a practicing dentist from Atlantic Canada, from Newfoundland. And he has been an absolute crusader in the quest to bring oral healthcare to every Canadian through our public system. And he's leading dental professionals across this country in that. It's a growing movement. And so without further ado, I'll turn it over to Dr. Doucet for his remarks.
Thank you, Don. I appreciate the introduction and for inviting me. And really, to kind of start talking here, I want to talk about how dental care in Canada is structured. Because when we say dental care isn't included in our universal healthcare system, what we mean is that, the government doesn't provide health dental insurance to people as a right. Because of this, people rely primarily on work-related benefits and out-of-pocket payments to access dental care. In fact, it's the overwhelming majority of dental spending at about 95% of dental spending, and only a meager 5% goes towards targeted government programs. This is even lower amount on government spending on dental care than even the Americans, which is a low bar. And because we spend so little on these targeted government programs, the people who rely on those programs often struggle to find a dentist who will accept them. And also the programs that they rely on will favor extracting teeth rather than saving them. Also, even with these targeted programs, to repeat some of the numbers Don has mentioned, is that, there's still 1 in 3 Canadians who lack any form of dental insurance, and over 1 in 5 who avoid the dentist each year because of financial constraints. And when people lack dental insurance, they really usually only seek care when they're in pain, when they have infection, and in the meantime, those smaller problems, they fester, they grow, they get worse. And it's very common for me to see people coming in saying, I have a toothache, I need help with this. They know they have other problems, but they're not able to get that care. And it's something that the dental care system is structured in such a way where these people, there's large segments of the population that fall through the cracks. And this has problems that go beyond our mouth. So, poor oral health, it's been shown in many different ways to cause or worsen many general health conditions like heart disease, like diabetes, like stroke, among many other conditions. It also affects your self-esteem. It affects your employability if you have missing front teeth or visible decay. Also, I'm sure anyone here who's ever had a toothache, they know how miserable it is. It really affects your quality of life. It affects your ability to sleep, to focus at work. It's a really miserable thing. And when people are in such pain, when they have infections, when they have a swollen face, they turn wherever they can to get dental care. And this results in a lot of people going to their doctor's offices or emergency departments because they have dental pain. And it's a place where physicians aren't equipped to provide these services because they don't have the equipment to extract teeth. They don't necessarily have the training for that. And it's something that it's not an insignificant problem. For instance, in Ontario, there was a study done in 2014 that showed doctors' offices were visited every 3 minutes and emergency departments every 9 minutes by patients seeking treatment for dental pain. And to kind of give a number to this, nationwide, this problem is estimated to cost about $150 million a year. Keeping in mind, when people do this, like we spend that money, yet these people, all they're given is an antibiotic and a pain medication, which often comes in the form of an opiate, considering how bad the dental pain is, and they're still left needing to be treated by a dentist. So if we had a system that allowed people to go see a dentist, we would save money on the back end by not having people need to go to their doctor for dental pain. And these problems that I've talked about so far, I hate to say it, but they're actually getting worse. If we look at the nature of the economy, what we're seeing is there's a lot of people who are retiring and losing their work-related benefits. And we're also seeing a lot of people working in the gig economy. So these are jobs that are fairly precarious, that don't provide benefits like dental insurance. So the number of people who lack dental insurance is rising. And these are trends that are in place before COVID-19. Now with the COVID-19 pandemic, people are facing even greater financial hardship. People are losing their jobs, they're working reduced to no paid hours. And what this means is that more people are going to lack access to dental care, and more people are going to suffer if we don't make big changes to the way dental care is delivered in Canada. And because of these problems I've talked about so far is why I formed the group Coalition for Dental Care, as well as to advocate for a more humane alternative. Just to briefly mention the NDP dental care plan, And just to put context around this, so the dental plan is expected to they want to provide dental insurance to families making $70,000 a year or less with no co-payments, and between $70,000 to $90,000 a year with some form of co-payment. Just to put this in context, this would be if it came into being, it would be the single largest investment in oral health in Canadian history. It would more than double the amount governments currently spend on dental care in Canada. And we should really see this as a first step for bringing dental care fully under our universal healthcare system. And what we at the Coalition for Dental Care see as bringing dental care under our universal healthcare system, it has multiple components to it. So the first thing is that we want you to have dental insurance throughout your entire life. And the best way to do that is by having the government, like we do with our universal healthcare system, ensure everyone has dental insurance. When you have the mixed public-private plans, you might have dentists prefer treating people in the private plan versus the public one. So having a universal system eliminates that discrepancy. And also, you shouldn't have to worry about losing your benefits if you become unemployed, if you retire, or even if you rely on your spouse's insurance and you leave the relationship. People shouldn't have to worry about that form of instability just to access a basic health service. Also, when people have dental insurance throughout their life, they don't have to neglect their teeth for years, which means we're raising the floor as far as the level of oral health in the population, which has many downstream effects. Also, beyond just having insurance, because just having dental insurance doesn't guarantee that you have a dental provider, we at the Coalition for Dental Care also want to have a robust sector of publicly owned dental clinics in places like community and Indigenous health centers, schools, long-term care facilities, prisons. I'm sure there's others, but those are the ones that are just coming to mind. And these publicly owned clinics help bring dental care to those communities that currently lack access to dental care more efficiently. The providers in those clinics can be paid a salary rather than the fee-for-service model, which allows those providers to spend the time and energy needed for those people with more complex oral health needs. It also allows us to put a greater focus on prevention because practitioners aren't worried about rushing to get to the next patient. Also, with that public ownership model, we can bring into the mainstream what are known as dental therapists. Now, these are dental providers who can perform procedures like fillings and extractions at a fraction of the cost of a dentist. And when we look at the cost of a public dental care plan, dental therapy is the dental providers are the biggest cost. So if we can maximize the use of dental therapists, that dental plan, we're going to make our tax dollars go much further. And we had a dental plan with dental therapists in Canada at one point in Saskatchewan in the 1970s and 80s, brought in by Alan Blaney from the Saskatchewan NDP, who had dental therapists working in school-based clinics. And it was wildly successful. Over the first 10 years of the program, the need for fillings and extractions went down by half because children's teeth were that much healthier. And we want to take that model. So the program was later privatized by the Conservatives, but we want to bring that back and bring dental therapy into the mainstream in Canada, not just in schools, but in many other areas as well. So, I think now is probably a good time. We'll introduce Joan. So I'm going to hand that over to her. She is a former adjunct professor in the faculties of Law and Dentistry at the University of British Columbia, and also a very well-spoken advocate for people with disabilities. And I've had the honor to work with her over the years.
Thanks very much. When you're introduced as both a lawyer and an academic, it pretty much assures most people are going to turn off their computers now. I hope that's not the case. I would like to thank very much both Don Davies and Rachel Blaney for inviting me to join you. This is terrific. I'm sorry, I'm just going to put myself at the right spot. I apologize for being a bit late. I got confused on the Zoom access, but I'm grateful to have an opportunity to speak about the lack of access to essential oral health care facing vulnerable Canadian citizens. And Don described them pretty well. I've grouped them as well as generally vulnerable groups include adults with developmental disabilities, the frail elderly, Indigenous Canadians, and low-income Canadians. And Canada, in my opinion, just like Brandon's and Don's, Canada must incorporate universal dental care into our universal healthcare system to ensure that the country meets the oral health needs of all vulnerable citizens. Now, my particular advocacy, as Brandon mentioned, focuses on adults with developmental disabilities. While community services that he mentioned might be able to serve most Canadians if they don't have dental plans, many adults with developmental disabilities can't access treatments in standard community dental clinics. They need specialized care and often access to general anesthesia, but certainly trained care, which we don't have. In BC, our Ministry of Health has not equipped our hospitals to meet this need, and the dental profession has failed to train professionals of all kinds, to provide specialized care. I must be fair here and say that that's somewhat across the board, both dental and medical, but profoundly so in the area of dental. There's just not any training really. It's not required in the mandate, in the curriculum for dentists. As an example of this problem, and since Ms. Blaney represents the North Island, I'd like to start by mentioning Jocelyn, beautiful young woman from the Comox area of Vancouver Island. Jocelyn was born with a rare genetic disorder that created mobility and intellectual challenges. Jocelyn was a much loved member of her family. Jocelyn's disabilities complicated her ability to access dental treatment, and without preventive and dental treatment, Jocelyn began to suffer serious dental decay. Her teeth began to break, leading to more severe dental infections. Some of the medical professionals who treated Jocelyn recommended pulling all her teeth, which is the one thing I think maybe both Don and Brandon mentioned that MSP will cover, is extraction if it's done by an oral surgeon. But Jocelyn's jaw, owing to her disability, had structural anomalies, which would have prevented her from wearing dentures. So she's immediately thrust into a complete liquid diet. And so Jocelyn's family sought expert dental care, all in vain, to no avail, even though they were themselves qualified professionals and excellent advocates. In 2016, Jocelyn entered hospital twice with lung infections that, according to the hospital medical professionals, those hospital-based doctors, they thought that the lung infections resulted from the decay in her mouth. Jocelyn died in December of 2016 in hospital. She was 30 years old. Among other sad lessons from Jocelyn's story is the fact that severe dental decay potentially leads to death. And so it's not by any means minor. Among all the other awful things that Brandon and Dawn have mentioned, this is a risk to life, not merely to our overall health. Jocelyn's story as a person with a developmental disability is not uncommon, but it is unknown. People with developmental disabilities in Canada face the problem of invisibility in many ways. This invisibility is especially true regarding their lack of access to essential oral health care to prevent infections, avoid pain, and to keep their teeth. So the only solution to stories like Jocelyn's is to embed dental treatment into our universal healthcare systems so that our ministries of health are responsible to ensure that vulnerable citizens like Jocelyn can access prompt treatment for oral health. And so I'm going to make, on that note, three can't count, typical academic, 3 points today. My first point, Canada must ensure accessibility to oral health. Oral health is essential for overall health, and therefore it must be accessible. Accessibility is the key word here. We agree in Canada that access to medical health care must be equitable. And to ensure equitable health care, our Canadian Medicare system incorporates 5 principles. And those are that the provincial healthcare plans must be publicly administered, comprehensive, universal, portable across the country, and accessible, meaning all insured persons have reasonable access to health care. Similarly, access to oral health must be equitable. It will only be equitable if it is universally accessible. It is unjust, discriminatory, and therefore unlawful, I say that as a lawyer, for our oral healthcare professionals and our governments to fail to ensure equitable access to essential oral health care for persons with developmental disabilities who often have no voice and cannot speak for their needs. Canada must incorporate oral health into our universal healthcare system to meet the essential oral health needs of all Canadians, including our most vulnerable Canadians. Now, my second point is that Canada's healthcare system, including our Canadian medical and dental professionals, must recognize the special medical care needs of persons with developmental disabilities and provide suitable treatment facilities and services. People with developmental disabilities can't stroll into a local community dental clinic, as I mentioned. They might be in a wheelchair, but their complications may be more complex simply than mobility challenges. They have a variety of other problems, often behavioral, that are going to prohibit them sitting calmly and allowing a dentist to do work in their mouth. Training would help, both them and the dentist, but they won't be trained to be comfortable in a dental chair until the dentists and hygienists and other dental oral health professionals are all trained how to make that happen. People with developmental disabilities often need specialized facilities for anesthesia, and our medical care system simply fails to provide those facilities properly equipped for dental anesthesia. The regulators across Canada, our provincial regulators who jointly approve specialties, have failed to approve dental anesthesiology as a specialty across the country. Only one province has approved it. They went on their own because the rest of the group did not take action. Our dental faculties fail to train the dental and dental hygiene students to meet the oral health needs of adults with developmental disabilities. In short, Canada fails to ensure that these individuals even can receive prompt treatment for both preventive and acute oral health care problems. To repeat, our medical healthcare system must provide treatment facilities and services that serve the needs of adults with developmental disabilities. And my final point, treatment for persons with complex health issues, such as developmental disabilities, must be based on need and not on the scope of a limited dental plan. I'll give us an example, our BC dental plan here. The BC plan for adults with disabilities is over 30 years old. The list of covered treatments under that plan has not been updated since the 1990s. The plan doesn't cover many standard treatments, preventive treatments even, such as fluoride. Fluoride applications are not covered, which is always amazing to me because fluoride is as cheap as sin, but they don't cover it. So plan fees have been frozen under the provincial disability plan since the early 2000s, and they're now less than 50% of the recommended BC Dental Association fees. So of course many dentists don't want to accept these patients. They argue that their overheads are not covered when they take those patients. So the plan overall has low aggregate limits. So, I mean, goodness help anybody who's got a serious dental problem because they'll run out of the aggregate coverage very quickly. And I'm told that other provincial plans are even worse. For example, Ontario pays even lower fees for dentists to treat the developmental disabilities than PEI. They will only cover emergencies. So there's no plan at all for people with disabilities. people with very complex health needs, that range across the board, truly cannot access care in this country. It's quite shocking. So we will achieve that goal if we include dental treatment within our Canadian medical healthcare system. So to repeat my 3 points, we must ensure equitably accessible oral health by incorporating oral health into our medical healthcare plan. The system, the healthcare system, including both the medical and the dental professionals, must recognize the special medical care needs of persons with developmental disabilities and must provide suitable treatment facilities and services. And finally, treatment for persons with complex health issues such as developmental disabilities must be based on need and not on the scope of some limited plan that could rapidly become outdated and unsuitable. So I want to thank you very much for listening, and I look forward to hearing your questions.
Okay, it's going to Dawn.
Thank you, Rachel, and thank you, Brandon, and thank you, Joan. And every time I hear Joan speak, Joan, you have a powerful way of communicating the real humanity of this. And I think we all know people who are vulnerable in our community, and it just, to me, it's a very profound reminder of the people behind this policy. Now, I'm going to turn for my remarks to basically some positive steps about what we can do about this, because I think we all can very clearly see the need. I think we all see the logic in it. I can tell you as health critic, this issue is extraordinarily hot. Of all the issues in healthcare, I can tell you that the need for dental care is something that I think the population is way ahead of politicians on. Because I don't think there's a family in this country that's untouched by this. And as Dr. Doucet said, you can ignore certain health issues. I shouldn't say this about pharmaceuticals, but some pharmaceuticals you can actually skip prescription. You can actually do without some of them. But when you have an oral issue, if you have a cavity, you cannot avoid dealing with that. And it's very real and present. So what can we do about this? As Joan powerfully pointed out, and I agree with her, I personally think if you read the Canada Health Act, dental care should be covered. I think it falls squarely under the current language in the Canada Health Act, but it doesn't, it's not been interpreted that way. So what the NDP has done, as we led the way for the establishment of Medicare in this country in Saskatchewan in the 40s, and then for this country in the 60s, we're doing it again in the 21st century. In the 2019 election, we were the only national party, major party, that put together a comprehensive plan to bring universal dental care to every Canadian. And the way we did that was we put together a plan that would first cover, as an interim measure, every Canadian or Canadian family who makes below the median family income of $70,000 a year and who does not have dental coverage. And the theory was that would be a down payment on universal dental care by getting the people who most need it covered first. And then we would gradually extend that to universal coverage for everybody through our public healthcare system. And we costed out that program. By the way, it actually goes up to $90,000, but after $70,000, it starts getting co-payments on a dollar for dollar basis between $70,000 and $90,000, where it's faded out. And the theory was people that make over $90,000, whether they have dental coverage or not, are probably likely to be able to pay for it if they need it, whereas people under the median family income are not. So we took the unprecedented step of having the Parliamentary Budget Officer cost that program, and they did. And now we're talking about a comprehensive program. It covers everything. It covers fillings, it covers diagnostics, it covers restorative work, it covers preventative work. It even covers orthodontics, if it's a required orthodontic procedure. And so it's a very, very wide, good program for Canadians. And the Parliamentary Budget Officer in 2019 found that it would cost about $3 billion for the initial setup. And then after that, it would cost on average about $1.6 billion per year. At that time, he found that that would cover about 4.3 million Canadians. So we put that on the national agenda, and frankly, the Liberals took note because they actually included a reference to dental care in their 2019 throne speech. They said it was an idea worth considering. So classic Liberal response. But nevertheless, they were paying attention because they put it in that. I then moved a motion at the Health Committee to study dental care, and we would have been studying that this Parliament, except for the COVID pandemic obviously has knocked us off our regular agenda. Now, in 2020, in the fall, we actually had the Parliamentary Budget Officer cost out the program again. Now, this is only a little over a year later. In that 1 year, it went from 4.3 million Canadians to 6.5 million Canadians. And why? Because in that 1 year, over 2 million Canadians lost their jobs and therefore lost their employment-based benefits, once again showing the precarity of basing access to healthcare based on on unemployment benefits. Now, to put this in perspective, every year in Canada, we spend totally, from all sources, provincial and federal, about $265 billion a year on healthcare. So again, $265 billion. So imagine if we could cover every Canadian right now who doesn't have access to dental care, who makes under the median, for an additional 1.5 billion. That's about half of 1%. We think that's an absolutely justifiable, affordable, and very overdue expenditure, actually an investment. And by the way, the Parliamentary Budget Officer did not subtract from that amount potential cost savings. I think in Ontario, I think Dr. Doucet covered this. In Ontario, the figures are someone goes into emergency every 9 minutes with a dental problem, and they don't fix it. I mean, they might give painkillers, they might make the person comfortable, but they don't actually, they might extract the tooth, but they don't actually do anything that's going to help the person retain their teeth or fix their oral health care problem. So, and by the way, in terms of universality, that is ultimately where we must go. Over the last 100 years, at various times, various provinces have had some form of partial coverage. Sometimes they cover, children for cleanings and basic exams. Sometimes they have a means-tested program. And pretty much every time, those programs end up petering out. And they peter out for two reasons. One, because when the provinces get into fiscal problems, the first thing they cut are these kinds of programs. Why? Because they affect marginal groups. They don't affect everybody. That's one of the benefits of universal coverage. Try taking away healthcare from Canadians today. Whether you're Jimmy Pattison or whether you're Rachel Blaney or Don Davies or anybody, we all have equal access to the Canadian healthcare system, and we all have a stake in it. And I think that's a very important bulwark that protects that system. And the second reason is because what ends up happening is governments have historically cut the fee schedule for dentists over time to the point where I've talked to dentists who said that they actually lose money sometimes treating people on these kind of boutique little programs. By the way, it's one of the main concerns of dentists in this country is that they're terrified that we won't have a fee schedule that protects them. And I've met with the Canadian Dental Association on a number of occasions and assured them that we're talking about simply folding dental services into our public healthcare system. If we can pay cardiac surgeons to do quadruple bypasses and transplant specialists to transplant kidneys and livers and do hip replacements and pay for the very, very highly skilled panoply of healthcare professionals, from psychiatrists to surgeons to general practitioners, there's no reason whatsoever that we can't move dental professionals into that system. So they and negotiate fee schedules just like we do for docs. So we're going to campaign hard on this again. I think that the population is behind us. I will say this, and I'll end on this one little partisan point. I don't believe that we will ever get an expansion of our public healthcare system in this country until we have an NDP government or an NDP, whether it's majority or minority, or a Liberal minority that has NDP support to get a majority. We could do it this Parliament, except for we're in the middle of the COVID pandemic. It has completely thrown off all normative politics as we focus on this pandemic. But, you know, when I see the Liberals promise pharmacare and they just don't do it, and they don't do it in a minority parliament where they have NDP support and they've promised it and they've pledged it and they still won't do it, I don't believe that you can trust any other party but us, and perhaps the Greens, maybe, to support public universal dental care in this country. But I tell you, you will not have it until we have New Democrats in Parliament in sufficient numbers to make this a reality. And you know what? It's overdue. We've waited 50 years for this. It's time to move on this. So thanks very much.
Well, and thank you, Don. And we're getting a bunch of questions. And so I'm going to ask, and whoever's the best to answer it of you three amazing panelists, please do. I do want to point out, though, that I do represent Vancouver Island, but I'm actually also on the mainland, especially Powell River is on the mainland. So I just want to acknowledge all of them. The first question that I have is, and I think you talked about this a little bit already, Don, but what are the major roadblocks in opposition to passing this national dental plan? And what are the cost savings to the government and taxpayers by providing this essential preventative care?
Oh, what a great question. I'm happy to have my co-panelists jump in. I think on the political level, inertia. I don't think the old traditional parties actually, well, put it this way, I'll split them up. The Conservatives don't believe in it. And I'm not saying that to be nasty. I sat through them for 2 years as we studied pharmacare, and they are not in agreement with any expansion of our public healthcare system. They prefer private delivery. For the Liberals' part, just inertia. I mean, they've been in power for 100 of the last 150 years. They've had many majority governments since the 1960s and many opportunities. I just don't believe they're committed to an expansion of our universal public healthcare system. I think also up to now, there's been maybe a lack of the important work done to estimate the economics of it. I mean, that's why I think it was so critical for the NDP to put this to the parliamentary budget officer, who, by the way, is no raging lefty. The PBO is it's a very conservative office. They're an independent office of Parliament. They make very conservative assumptions. And so the numbers that come from there are very highly reliable. And so that's why I think putting shape to the cost of this program is a very important part of the structure. I'll turn over to Dr. Doucet, who might be able to speak to resistance maybe in the dental community.
Sure, yeah. So really, when we look at the major roadblocks to having universal dental care, I think Medicare is a great example of that. So if we look back at the history, when Medicare was being implemented in Saskatchewan, the doctors went on strike. You know, they were the biggest opponents. And I think that's a very interesting lesson, because I do think there's a good chance we're going to face something like that with the dental profession. If we were to try to do this, there's going to be a lot of people who are on our side, but there's going to be people who aren't. And part of the reason for this is because, you know, something that's already been mentioned is how meager the existing targeted government programs are. I think there's a lot of fear among dentists that a universal plan is going to be very meager like that as well. But I think it's something that education and understanding, when everyone buys into a system, it's a much more robust thing, because you can't underfund these programs as easily, because you face major backlash when you attack something that everyone relies on, rather than just some small program that helps poor marginalized communities. Also, I think it's important to note as well with the medical profession, they were against universal health care to begin with, but I think very few physicians nowadays would want to work in a private American-style healthcare system. You know, I went into dental school wanting to be a healthcare provider, not a salesperson. And I think that's a very important thing to note here, because I think many of my colleagues believe that as well. It's just they don't operate within a system that allows that to happen. Also, when we look at, the second part of the question here, so what are some of the cost savings for the government taxpayers? The population having better oral health has so many benefits. People don't have to go to their doctors for dental pain. Also, poor oral health, which is really exacerbated by people not being able to afford to get dental treatment, causes a host of conditions, as we most mentioned, worsens many general health conditions with increases healthcare spending. Also, it affects things like the ability to chew, which is going to make it harder to have a nutritious diet. Also, various other things as well, like employability. So really what we're hoping to have here is giving people a fighting chance to have a dignified quality of life. There was a very interesting study that I saw that looked at providing comprehensive oral health treatment to people struggling with addiction. And what they found is that the people who were going through addiction treatment who also got comprehensive oral health treatment were less likely to be homeless, less likely to relapse, and more likely to find employment. So this is something that the benefits go far beyond our mouths. There's so many benefits here. And I think we need to get out of the mindset where we look at things in, oh, this is going to cause increased government spending, because Canadians already spend a lot on dental care, and that's something that doesn't get talked about enough. It's just you're paying it out of pocket, you're paying it through your work-related insurance, and there's a tiny amount going towards government programs. We know with our universal healthcare system, it's a more efficient delivery model to treat the population. So I see no reason why we can't provide dental care to the entire population for the price we do now, for the price we already spend.
Yeah, and I think that's an excellent point. And it's interesting because it leads into the next question. So this person said, I'm really embarrassed, but I've not been able to access dental care for over 10 years. And just so everybody knows, in the mailouts that we sent, we saw a lot of people with more than 10 years. One person said, I haven't been to a dentist in 30 years. So what this person said is, it feels scary because how can I afford what I need to get the help that I desperately need? And so that's the question. Hard one to answer, and it's that part that Dawn said so well. These are the stories behind the realities. It looks like numbers on paper, but people are really struggling. And I think when you talked about employment, that's really important as well, because we have people who have talked about the lack of their ability to get employment because they don't have proper health care. Another question is, does anyone have an update on the status of the dental clinic program at the Pacific Autism Family Center in Richmond? I don't know anything. Does anyone here know?
So it's currently, it didn't ever really come into operation. It was a hope. The Life Labs agreed to set up at the Pacific Autism Center a little medical center so that people with autism could get blood tests, etc. And the group hoped that a dental clinic could be set up, but there was never really any hope for it. They basically had a chair, and I think the best opportunity perhaps would have been just to train dental hygienists and maybe dentists, but train students how to make the persons with autism feel comfortable having someone near their mouth. But I think it's something to remember that autism is a very wide spectrum. My son is diagnosed with autism, and he does not speak or read or write. He is very cognitively challenged, and he would not accept a vaccine at the big vaccine clinic. So we had to arrange for someone to come to his home, a community health nurse, and she was great, 3 tries, and on the 3rd time lucky. But you can imagine a person like him, he's diagnosed with autism. He's not about to sit in that chair and let someone, do much with his mouth, where an individual who is much more high functioning, sorry to use that word, it's probably inappropriate, but who has fewer social phobias than a person like my son, who is much more able to be social, but still has challenges with autism, but is cognitively able to understand the need for the dental examination. they'll be able to sit down. But the result was that it really never went ahead. I'd like to just mention one more program in BC, though, that was critical for us, is still as such as it barely exists. But the Community Dental Partners Program was set up in 2004. There had been, as part of this Persons with Disability Dental Plan, originally the plan included anesthesia. And then quickly the government realized that's not what they wanted to be paying for. So they broke it out and they gave administration of a fund to our children's hospital because they had a dental clinic with actual treatment centers. The idea was they would fund anesthesia clinics around the province to enlarge access to treatment for persons with disabilities around the province. It would mostly treat kids, but it would include some people with developmental disabilities. But that was 2004, and it was barely touched or noticed. I think the fees went up once in 2010, and that was the last time. Well, anesthesiologists, as Don probably well knows, have been very successful as medical anesthesiologists in arguing for good pay. The dental anesthesiologists working in these facilities, even the medical, if they were working in these kinds of facilities, they weren't getting any increases. So now, out of the high point, there were 10 of them around the province. Now there are only 2. And so they're both in the lower, well, they're both in Metro Vancouver. They're not in the lower mainland. They're both in Metro Vancouver. And so if you live in Fort St. John, one woman with a developmental disability with, real challenge, couldn't get any place in BC. She went to Edmonton for care in the hospital there. You have no idea how many people call me from, Powell River has many folks with developmental disabilities, but a lot of places around. The island has been very, very strained. Nanaimo used to accept some folks in the, surgeries in the hospital, but then stopped. Access to care for folks who need it under GA, it's almost non-existent in this province. It's really a horrifying situation for complex care patients. Anyway, thank you. I hope that answered the question.
No, thank you for that. And I think that is so important. It's the complexity of this issue. And especially when you're talking about persons with disability, that's a broad spectrum. So there isn't a simple one size fits all. And I think that's why it's so important that we look at a system that is more public so that we can have that accessibility. So I'm going to ask one last question, and then I'm sorry, I'm going to have to wrap it up. I want to be pretty mindful of the time. But the last question that I got was, and we had Patricia talk about this a bit, as well, is rural and remote communities have challenges in terms of accessing dentists at all, and then the added cost of having to travel or take a ferry to get to the services and supports they need. How will the NDP plan support that and make a change? I'll leave that to you, Don.
Well, that's a really excellent question. And in fact, right now we're in the process of, I think, focusing on the healthcare human resources, frankly, crisis that our country is going to be facing in the years ahead. And it's not just in dental care. There's a number of services that I think rural and remote areas are simply underserved. There's been an explosion in virtual care. I think that's really provided some really interesting access improvements to a lot of healthcare services, but ultimately in dental care, you've got to have someone, with their hands in your mouth. So although diagnostics and x-rays and things, there may be some room to improve services through virtual care that way. This is a very serious problem. I think we need a national solution. There are a lot of healthcare groups that are pushing for a national human resources strategy that will have a long-term plan for how we make sure that we can do a better job of getting healthcare professionals into underserved areas. That's probably going to take some time to do. I think it's probably going to be a combination of an incentivized program. I mean, some of the proposals that the NDP has put forward is for anybody who has a student loan that graduates, say, from dentistry school, if they settle in an area that has a per capita need below the median, then every year that they stay there, a percentage of their federal student loans would be eliminated. So say, 20% per year over 5 years, and then that would encourage someone to be in an area for 5 years. Another thing is, I know this is happening in medical schools, but the entry criteria to a lot of these professional schools used to be based on very narrow criteria, like your marks and your, if you wrote the dental test or the MCAT or whatever. Now they're starting to look at things like making sure they balance admission to the professional programs based on a number of factors, like where you're from. And the theory is that if you had someone from, say, the Sunshine Coast who was going to UBC, and you try to get more students into the professional programs, it's more likely they will go back to their communities and set up their practices there. The other thing I know Dr. Doucet has been a real champion of is widening the scope of practice. There's something called a dental therapist. It's almost the equivalent of a nurse practitioner, where you take the highly skilled dental hygienists and dental assistants, and with extra training and stuff, they can be trained and qualified and licensed to do other procedures, perhaps simple extractions or fillings or things like that, under the supervision of a dentist maybe. So I think that's part of the solution as well, is to take a look at how we're delivering these services. But it is a very important question, and it's going to need I think a national focus to tackle and take some time to fix. I see Joan has got her hand up.
And probably Brandon too. I have one point to make. The BC Children's Hospital, just as it is across the country, the most frequent surgery of any kind of surgery performed at the hospital is dental surgery for children. But to serve the outer regions, the former chief of dentistry at BC Children's recommended putting a team of his dentists, some of them outside and himself, and some pediatric specialists, and then them traveling as a group to, sort of pick a kind of a road trip, go to Haida Gwaii, over to Prince Rupert, go on to Prince George, but go, various areas, rather than make people travel down to Children's in Vancouver, a very expensive trip for a lot of families. They would travel up and see a lot of people. But the Ministry of Health said no, despite the imposition of cost on families who often would not be able to make the trip, couldn't afford it. There's no offset for travel. But those are the kinds of initiatives that I think a number of dentists are willing to make in order to serve communities, but they have to be funded. And so as long as a plan is willing to accept that kind of concept, there are ways we could give more service to rural regions. Sorry, Brandon, go ahead.
Yeah, I just wanted to add something to what Dawn was mentioning as well with the dental therapy program. For me, that's one of the most exciting things to talk about, because really one of the biggest hesitations I get from people is, how much is this going to cost, and, concerns around that. And also, will I have a provider nearby? And when you look at dental therapy, you realize that the per unit cost of delivering services can go down quite significantly, which means our tax dollars can go further, and we can also increase the dental workforce significantly. So if we look at a rural community, let's say they should have 2 dentists to meet the population demands, and there's only one that's willing to go. Well, if you have a dental therapist there, taking a lot of the burden off of the dentist's shoulders but when the dentist is there, the fillings are done, the simple extractions are done, the cleanings, the treatment plans are all ready to go, the x-rays are taken. That maybe one dentist could serve that community if you had a dental therapist, but it allows us to expand the dental workforce, along with the public ownership model allows us to allocate that dental workforce in a more efficient manner, because we do see a lot of dentists setting up in cities, and there's kind of underserved in a lot of rural communities, along with low income communities as well.
Well, thank you. And for me, that's a big issue, because rural and remote communities have really unique and particular challenges. The good news, hopefully, is everybody seems to, over COVID, be moving to our communities. It's hard on our housing costs, but hopefully we'll pull out a few more dentist and healthcare professionals. So I just want to thank all of you so very, very much. I also want to take a moment to acknowledge Allison, who is here today. I did a tea talk. She is a dental hygienist, and we talked about this very issue, and she just did a great job. So I'm really happy that she's here today. And I thank everybody. You know, we're seeing a lot of conversations, both publicly and privately, of people who see the value of this work and how important it is. And I think, you know, the NDP has done a pretty comprehensive process in this. This is not something that we take lightly. It's something we take seriously. And I thank Don Davies for the work. I mean, we have asked the Parliamentary Budget Officer to do work. We've brought multiple motions, and there's now one of our fellow MPs, Jack Harris, who's brought forward a private member's bill on this, just because we want to make sure that the government is aware that this is really serious. And I remember when we talked about having it in our platform the last election, I was thinking, oh yeah, that's good. I like it, but I did not even imagine how many people would be passionate about this. I knew it was a big issue. I'd heard about it, but it was just overwhelming. And so I'm so grateful that we've brought this forward. I know the solution isn't there, but this is the work that happens so that the solution can be a reality in the future. So a great big thank you to Dr. Doucet. It is very late where you are, so thank you so much for staying up so late to be here with us. And Joan Rush, like, thank you so much for talking about the realities from the disability community. I think it just brought that humanity that we need to remember when we're having these discussions. And of course, a huge thank you to Don Davies, who's one of my favorite MPs. Don't tell anyone I said that. But you know, he's been working so hard during COVID to just look at how do we get vaccines in the door as quickly as possible? What kind of things do we need to do in this country to make us safe? And how do we follow those health protocols? And if it wasn't for Don pushing, I don't think we would have some of the resources that we have in this country today. So thank you for your leadership. And thank you to all the amazing people that participated. We will make sure that this is set out so that you can share it with your friends. If there's anything that you didn't get to talk to us about today, please never hesitate to contact my office. We always do our best to get back to you as quickly as possible. So thank you again. I wish you a wonderful evening, and we'll keep this discussion and the work alive. It is so very important. Take care, everyone. Bye.